aimed to not reach blood or not to invade the dermal structures. And then I really like using something that is a dye marker to treat topically. So my favorite one is probably 7% tincture of iodine. You'll see pictures later, but A is a dye marker first. It will tell you A is the client doing it, is the client treating it, because if they're putting on tincture of iodine, their little concrete floor should have orange footprints. If it's a white horse, there should be some orange up here. They're gonna spill it. It should be on their fingers. And I say all that tongue in cheek, right? Like, you should obviously put it on with gloves. It should not go on to the sensitive structures or to the skin. But it is one of those things that you can tell, are they doing it or not. Same thing with thrush buster. We've all had that ugly purple put on our hands, and it stays for several days, right? Like, you're gonna know if they're doing it, right? Unfortunately, the chlorine dioxide solutions work great. You just have no proof if they're doing it or not, right? Like, they're not a dye marker. And then I do think these dye markers do a great job allowing you to visualize area of higher moisture content, which should be associated with higher microbial content, right? Because you don't have to get the entire debridement done today. I'll admit, maybe that's something that's just come with age and experience, but I used to try to get to 100% perfect healthy margins today, right here, right now, right? And something I think I've just adopted or learned from the vet side of it. There's nothing wrong with going back and rechecking it, retrimming it, 4 or 5 days later, do a little bit more debridement. You get to see, is the owner complying? Are they bandaging it? Are they keeping it in a clean, dry area? Something I think I often, typically used to default to that farrier thing of just a 4-week cycle. And I wouldn't see that horse anywhere in that 4-week cycle unless it lost a shoe or something. But for this, there's nothing wrong with trying to debride that to 90% healthy margins, and then come back and finish your debridement, 5-10 days later, whatever you want it to be. But I do think if you can get the owners to do it, wire brushing it, getting it clean, maintaining it in a clean, dry environment, applying whatever topical treatment you use, and then consistent rechecking for them, not just doing it and then not see that horse for 8 weeks or 9 weeks sometimes in Southwest Virginia.